The COVID-19 pandemic has been ongoing for 2 years, and one of the methods used to combat virulent spreading is through studying how it propagates. In its most basic sense, a compartmental model, which is a method where a population is divided into several compartments using ordinary differential equations or ODEs, are implemented wherein the population is divided into susceptible, infected, and recovered states respectively. The change from one state or another is facilitated by the ODEs, which represents how fast the disease spreads. However, compartmental models using ODEs assume uniform mixing of a population, wherein differences such as the difference in age group, which affect infectivity and mortality of an individual, are omitted and thus make a less faithful representation of the real-world dynamics of disease spreading. This is especially important in contextualizing spreading in areas where data is sparse and noisy, such as the Philippines, and more importantly, its rural areas with lesser testing capacity compared to metropolitan Manila. In an effort to study disease spreading in these areas, I employed a network analysis approach to study COVID-19 spreading dynamics in Tagaytay City, a rural area where my family and I live. The network model is implemented as follows. First, we use the Barabasi-Albert model or BA model, which represents a social network with n equals 85,330 to represent the population of Tagaytay. Then we use the Farce algorithm in order to divide this population into several households, with each household having an average number of 4.33 people. Now, the interaction in this model involves global and local occurrences. Local interactions are made up of the direct contacts of an individual, while global interactions represent the random interactions of an individual during the day. The compartmental model in this network uses SEIRD, which stands for susceptible, exposed, infected, recovered, and dead, wherein infected is subdivided into asymptomatic and symptomatic cases, and there is also a modification of contact tracing. Initial simulation of the BA network with Farce algorithm yielded three common results. First is underspreading, where the simulation ended earlier than supposed to. Then second is overspreading, where the simulation had much more infections compared to the supposed number of infections. And finally, results that follow a similar trend to the actual data. More of this to be discussed on my thesis defense on June 1, 2022.